And welcome back to day 3 of the first ever Kids Brain Health Virtual Conference. I'm your host, Dr. Brian Goldman. And this afternoon, we're going to continue exploring the sub-theme, moving online and harnessing the lessons of COVID-19. Up next, we turn to challenges presented by COVID-19, perspectives on implementing innovative solutions to mitigate the challenges faced by children with neurodevelopmental disabilities and, of course, their families. This session is sponsored by Queen's University and will be chaired and moderated by John Hepburn, CEO and Scientific Director of MITACS. MITACS is the key link between industry and post-secondary institutions, driving collaborations at home and abroad to develop projects which solve challenges and develop the nation's innovation capacity. MITACS is passionate about developing the next generation of researchers who are helping to fuel Canada's knowledge-based economy. Dr. Hepburn, take it away.
Thank you very much, Brian, for that introduction and for the brief words about MITACS. I should stress that in addition to industry challenges, we also work on societal challenges, which is more what we're going to be talking about today. It's a delight to be here to moderate this session, which really is a celebration of a relatively new partnership between the Kids Brain Health Network and MITACS, looking, first of all, for solutions for kids' brain health in the COVID-19 crisis. Now, we support early career researchers who work in partnership between the organizations that we'll hear from later on in this panel discussion and academia to create research solutions to problems. And the problems, of course, are all well known to all of us. Now, I'm going to introduce the researchers that we're going to hear from. There are 7 research projects that we're going to hear about. To save time, I'm going to simply introduce them all at once by name with their affiliation. They will introduce their research areas. I'll apologize in advance for mispronouncing any names. So, in order, I hope, we have Vivian Lee from York University. We have JACALYN Guy from Western University. Maude Champagne from Queen's. Ashish Seth and Jessica Kohek from University of Calgary. Wendy Mitchell and ROSSLYNN ZULLA from University of Calgary, VANESSA FONG from Simon Fraser University, and BUSE BEDIR from University of Victoria. And now we're going to hear from them all by video. So if the videos could be shown now.
Hi, I'm Dr. Vivian Lee, and I'm a postdoctoral fellow working at York University under the supervision of Dr. Jonathan Weiss. And for the MITACS Kids Brain Health Network internship, I've been partnered with Autism Ontario, working with Mark Spoelstra. I'm so thankful to be a part of this internship and be able to work with an organization that has been so helpful to the autism community. Not only are they looking out for the well-being of individuals on the spectrum, they also have a vested interest in the well-being and mental health of caregivers and families of those on the spectrum as well. Part of this internship, I'm working directly with Dr. Jonathan Weiss in partnership with Mark Spoelstra. And for this internship, I am taking an evidence-based approach in looking at the impact of COVID-19 and the self-isolation policies that have put in place in order to limit the spread of COVID, and how that has impacted the mental health and well-being of families and caregivers of individuals on the spectrum. So in order to do this project, the first thing I did was look through the literature around the world where we were focusing on really the impact on the mental health and well-being of caregivers and families. We were also really interested in evidence that suggested emerging supports to help families address their mental health and well-being needs. In order to do my search, I was guided by a framework called the Family Adjustment and Accommodation Resource Model, or FAR model. And this model, or this framework, is often used to understand the processes that lead the family outcomes in the face of stressors. And in this case, it would be COVID-19, or the stressors brought on due to COVID-19. In my search, not surprisingly, we do find that, of course, caregivers and families are facing an increase in demands. There is definitely interruption in terms of their services. They're no longer accessing the interventions and the professionals that they had access to before. There's been interruptions in respite, limited social interactions with others, and also school-based supports, or even school itself, and limited access in that part, in those services as well. And not surprisingly, there's been reports from parents that there's an increase in mental health and other behaviors or challenging behaviors in their child as well. And in terms of my findings, we do see that there's limited evidence for supports that have come and have emerged in order to support families in terms of their mental health and well-being. And not to say that there aren't any, we do see that in the literature, there are certain adaptations that have been made in terms of how people deliver services to families that are really part of the capabilities and the capabilities to help with families meet the demands that are placed on them right now due to the pandemic. And this is where Autism Ontario comes in. After our findings, knowing the demands and stressors that are being placed on families, and knowing the limited number of supports that are out there, I've been working with the Service Navigator team to address the concerns that we know are very top of mind for many families. I'm also working with that team to better understand the needs, including the mental health and well-being needs of families, and to also keep in mind the community resources that are now available for families to make sure that they are addressing their mental health and well-being needs. So I'm loving working with Autism Ontario. I love that I can take an evidence-based approach to making informed decisions within the organization. I've been involved in other projects looking at supporting families during this time, and I look forward to continuing using my research expertise to help the organization using an informed evidence-based approach to supporting families on the spectrum.
Hi, everyone. My name is Jackie Guy, and I'm a postdoctoral research associate. And today I'm going to speak to you about the work I'm doing as a MITACS Accelerate Fellow at the University of Western Ontario in partnership with CASDA, the Canadian Autism Spectrum Disorder Alliance. The COVID-19 pandemic has created a number of unique challenges and additional strain for autistic Canadians and their families. The government and research community responded quickly in trying to understand and address these specific challenges. Indeed, information and surveys about COVID-19 were developed and shared via various outlets throughout Canada. However, the abundance of online research has highlighted some key issues, namely that research efforts are often uncoordinated, which can then lead to duplication, difficulties in drawing meaningful indicators, and ultimately inconsistencies in bridging research to practice. The crucial need to coordinate autism-related and pan-disability data collection initiatives has never been more apparent, particularly as we rebound from the pandemic. Further, the current climate has underlined that Canada does not currently have a comprehensive research framework to generate shared knowledge to serve autistic Canadians. The government does not have national standards for autism research programs or methods of evaluation, nor does it have a way to coordinate different levels of knowledge exchange between provincial, territorial, and federal partners. These early observations encouraged us to think about how the autism research landscape could be improved in Canada. And the timing for this could not have been better, especially since CASDA has been advocating for the development of a national autism strategy. Since the release of its blueprint in April 2019, CASDA has been working to support and aid the Canadian government to develop and implement a national autism strategy focused on 5 key priority areas: affordability and access, information, employment, housing, and research and governance. And the following project will focus on research and governance. In this project, we aim to build on this strategy to answer the following question. How can we transform and improve the autism research landscape in Canada? KBHN Policy Fellow Daljit Gilbadesha has provided the foundational work in exploring autism research in a working group this past summer. This project will build on their recommendations to understand how the government can provide leadership and investment that can be coordinated and measured across key areas of support for autistic Canadians. To answer this question, we will explore the research landscape in a framework, including themes of planning, funding, implementing, translating, and using. We will conduct a scoping review of the literature to understand these themes both from a national and international perspective. This will help us to understand frameworks for other types of research, international research models, and Canada-wide commitments and community priorities. These steps will help to clarify key considerations, identify knowledge gaps, and generate recommendations. National level stakeholder engagement with autism researchers, autistics, persons with lived experience, and organizations in the pan-disability sector will also help to build and propose ways to transform the way research is coordinated and serves autistic Canadians. Early learnings from our research suggest that themes of this framework are cyclical and feed into each other, and that there are many common aspects to consider across these themes. Specifically, aspects of collaboration, coordination, representation, and participation will be necessary in establishing national standards. In terms of planning, for example, strategic partnerships amongst funders, researchers, decision makers, and stakeholders will be important. In terms of implementation, we have found that connected approaches to autism research will accelerate scientific advancement. Multi-site recruitment, including academic, clinical, and community settings, could grow studies and trials and improve data sharing, could it reduce research duplication. And finally, in terms of translation, interaction, exchange, and mutual learning between researchers, community services, and decision makers will be critical, especially for translating research within different contexts and cultures. It is my hope that this short presentation has encouraged you to think about Canada's autism research landscape and consider some ways we can engage in a meaningful dialogue. We would love to chat with you more about how to develop this research framework. My colleagues Liz and Sharon are presenting a poster with some more information to expand on the ideas overviewed here and are keen to hear your thoughts and feedback. We look forward to seeing you at the poster session. And of course, please feel free to connect with me should you have any thoughts, comments, or suggestions. Thank you very much.
Hi, I am Maude Champagne, a PhD student in neuroscience at Queen's University under the supervision of Dr. James Reynolds. Through this MITACS internship, I have the privilege to collaborate with Able2, a community-based agency in Ottawa. You may have heard about Able2 from its previous name, Citizen Advocacy Ottawa. This agency serves individuals of all ages across the disability spectrum. As part of this internship, we decided to assess 3 of their programs that serve children and youth with neurodevelopmental disabilities. The first program is FARP, Philological Resource Program, that you may know since it's one of KBHN funded project. The other 2 programs are 2 support groups. One is for siblings and one is for caregivers and is called WIMS. Since the beginning of the pandemic, staff has seen increased issues among the families they're serving. They have seen increase in mental health issues among all family members, increased challenging and even dangerous behaviors, as well as increase in isolation. And they also had moved their services from in-person to virtual. Since Able2 is a community-based agency, it felt important to consult with families about their needs and about how service delivery should be adapted. We chose to do a survey and some qualitative interviews. The survey is focusing on 2 main components. The first one is the well-being of the caregivers, and of their children. The second component is about assessing the satisfaction of the virtual services, especially support groups. Since FARP also provides service to families, we also decided to do qualitative interviews to ask about their satisfaction of the family support they're receiving now virtually. As expected, families had incredible feedback to give to Able2. I invite you to come and visit my poster and learn about the needs of families with neurodevelopmental disabilities during the pandemic and learn how to best advocate and support them during this crisis. Hoping to see you there. Thank you.
Hello, welcome, and thank you for viewing this poster walkthrough video. My name is Jessica Kohek, and for the last 6 months, my research partners Ash Seth, Candace Parsons, and I have been working together to identify challenges in community capacity building and knowledge mobilization within pandemic responses, specifically as these responses pertain to the disability sector in Alberta. Back in May, we partnered with the Calgary Ability Network as members of a province-wide task force that met weekly to discuss inclusive reentry strategies for persons with disabilities and for service providers. The meetings with this task force and a 100-person town hall helped validate the findings of our 2 research projects. My project specifically examined strategies community organizations could use to engage in capacity building in order to prioritize the concerns of persons with disabilities during the pandemic. To do this, I investigated the challenges faced by community organizations through academic partnerships and examined barriers and facilitators to catalyzing evidence-based practice into programs. COVID-19 was used as a focusing event to scope knowledge mobilization challenges. I hosted 5 focus groups using the nominal group technique, which allowed me to develop a ranked list of collective priorities from 24 community stakeholders representing local organizations in Calgary. The 3 main barriers identified by stakeholders included revenue loss, transition to online service delivery, and inadequate communication and collaboration with government. The 2 main facilitators identified by stakeholders included person-centered policies and programs and reciprocal partnerships. My policy recommendations were based on these collective priorities and included the following: consultation and education for community organizations, subsidies and grant provision for community-based research, and a formalized local network of community organizations, researchers, and policymakers to quickly mobilize research into practice. I will now introduce my partner on this project, Ash Seth, to speak about his project objectives and policy recommendations.
Hello, my name is Ash Seth. I'm a recent graduate from the School of Public Policy at the University of Calgary. My research study aimed to explore strategies through which governments could engage stakeholders like community organizations to design COVID-19 pandemic policies for persons with disabilities. I believe that this research had some exciting findings. To begin with, some of the barriers to engage stakeholders are inaccessible ways of consultation. For example, absence of sign language interpreters at the consultation venues. Furthermore, fear of participation is huge when decision makers and stakeholders come together in a room for policy making. The research participants proposed some approaches to overcome such barriers. Admittedly, creating accessible and navigable engagement environment is critical. Simultaneously, practices that involve separate consultation at safe spaces reduce the participation fear. Policy solutions are not far from reach. They are built upon the foundational policy-making principles of equity and cost-effectiveness. To know more about the recommended solutions and discover other interesting findings, do visit my poster on Day 3, November 12, 2020. Last but not least, my colleague Candace Parsons is going to tell you about the next steps of our project.
My name is Candace Parsons, and I'm a current Master of Public Policy candidate. Based on the research, our team developed a survey focused on COVID-19 re-entry strategies for persons with disabilities, as well as their caretakers. The survey asks the respondents about their experiences and possible solutions to issues. My task this semester will be to deliver the next steps in developing the survey. Currently, the team is working to revise the survey into plain language, which will ensure that the survey is as accessible as possible. Next, the team will distribute the survey throughout our networks. Survey respondents will mostly be completing the survey online. However, some surveys may be conducted over the phone. Once we have collected the survey, we will begin to compile the data, and we will also share the results with our networks, including policymakers, community agencies, self-advocates, and other stakeholders. If you'd like to know more about our work, please review our poster on day 3, which is November 12th. Thank you.
Hi, my name is Wendy Mitchell, and you're going to meet my research partner, ROSSLYNN ZULLA, in a moment. And we're excited to share with you our research project, which is entitled Information Needs for Individuals with Developmental Disabilities During COVID-19. This work has been funded by MITACS Accelerate, Kids Brain Health Network, and our partner, Pacific Autism Family Network Foundation, and is overseen by our supervisor, Dr. David Nicholas, from the Faculty of Social Work at the University of Calgary. Let me just take a moment to tell you a little bit about our partnership with the Pacific Autism Family Network. PAFN, for short, is a center of excellence and a network of supports for individuals with autism spectrum disorder and their families across British Columbia. PAFN's core purpose is to be a knowledge center, bringing together state-of-the-art resources for research, information, learning, assessment, treatment, and support, and building capacity across the lifespan for individuals with autism and related disorders. PAFN and its partners have developed the AID website. AID stands for the Autism and/or Intellectual Disability Knowledge Exchange Network. And it is a national network that is committed to providing accurate, up-to-date, and useful information and resources to the people who need it. AID Canada COVID-19 Resource Hub is a website that AID has developed that is specific to supporting individuals with neurodevelopmental disabilities and their families during the COVID-19 pandemic. We want to share with you our objectives for our study. So, as I mentioned, AID is focused on generating useful information and resources for individuals with neurodevelopmental disabilities, particularly during COVID-19. And those have an impact on individuals and families' experiences and impacts. And it's those experiences and impacts that ultimately influence the resources. Our research study is focused on reviewing these COVID-19 websites that support individuals with developmental disabilities and their families, determining what information and resources are accessed during the pandemic and their perceived impact, and examining how the AID COVID-19 website is experienced by individuals with developmental disabilities and their families.
Hi everyone, my name is ROSSLYNN ZULLA. Thank you, Wendy, for the kind introduction. So for this study, what we did was we used 2 methods. So I'm going to talk to you about the first method. The first one was looking at websites, in particular the content using an environmental scan and a review. And for this, we used Google Advanced Search. So some of the terms that we used were neurodevelopmental disability terms like autism, intellectual disabilities, and we use terms COVID-19 and resources. And so we inputted that into the Google Advanced Search, and we generated some websites or web pages. What we ended up doing was trying to create filters so that we could review a small number of websites. So some of the filters that we use included websites that were represented in English, had a national focus, so websites that offered information for an entire country instead of a local region, websites that had a Canadian site, websites that focused on neurodevelopmental disabilities and focused on giving information to children, youth, and adults. And then also included topics that related to COVID-19 and its impact on areas that are relevant to individuals with neurodevelopmental disabilities and their families. So I do encourage everyone to look at the poster titled COVID-19 Focused Websites focused on individuals with autism and intellectual disabilities, as that will give you a little bit more details of what we found. The second method that we used in this study was focus groups with self-advocates or parents of individuals with neurodevelopmental disabilities. And for this, we used Zoom. So what we really wanted to explore with these participants was what kinds of information they had access during COVID-19. And then we also wanted to learn from self-advocates and families about what the experience was in navigating the AID COVID-19 websites. So I encourage everyone to look at the poster titled Individuals with Neurodevelopmental Disabilities, Information Needs and Effective Methods for Sharing During COVID-19, so you can see the results of that focus groups. So this partnership with PAFN is really a collaborative partnership. So any research tasks, either through the website review or the focus groups, is shared with PAFN so that they have an idea of what kinds of revisions they can use for their websites. So thank you very much, and I hope you have a chance to review our posters.
Hi everyone, my name is Vanessa FONG, and I will be talking about my experience as a KBHN MITACS intern and about our partnership with the community organization ACT, the Autism Community Training. So just a bit of background on who we are. So I'm a PhD student in the Department of Psychology at SFU in the Experimental Developmental Program. My research interests are primarily in autism, specifically cross-cultural research, family quality of life, and incorporating a community engagement paradigm or patient-oriented research framework. And my supervisor is Dr. Gracie Orochi, who is the director of the Autism and Developmental Disorders Lab at SFU. We also collaborated with Dr. Alina Birmingham's lab, the Social Attention Group in Education at SFU, on this particular project. So now about our partner organization. So for this project, we partnered with ACT, specifically Deborah Pugh. So ACT is a not-for-profit society that provides information and training relevant to autistic individuals, families, and professionals. And the material that they provide is highly accessible and free, and many of the resources are available in various languages as well. So Deborah Pugh is the founder of ACT and currently serves as the executive director. Okay, so now I'm going to talk about the role of our partner. So Deborah Pugh was extremely engaged and a crucial member of this research team. She helped identify research priorities in her community. She helped with formulating our research questions and objectives, And her feedback on the various study documents, including the recruitment flyers and advertisements, really helped increase the number of participants recruited. And her feedback on the COVID-19 survey helped address important areas that our research team would have probably overlooked without her input. And her suggestions and comments on the consent form really improved the ethics of the study in terms of participants being able to fully understand the purpose of the research and, most importantly, their role in participation. She made very specific suggestions regarding removal of jargon in our materials and also helped to increase transparency on our consent forms. So these are just a few examples of areas that really highlight her contributions. So now I'll talk about the purpose of this project and this partnership. So the overall purpose of this partnership was to address a research question that was important to this community. And through this partnership, we also wanted to be able to increase the accessibility of these findings and be able to impact policy and decision making. So we partnered with Deborah and other collaborators to co-create an online COVID-19 survey for families of autistic children in BC. And our goal was to understand the impact of the pandemic on child and caregiver mental health, family functioning, and quality of life. We also wanted to evaluate caregivers' satisfaction with supports and services during the pandemic. So now I'll just talk about some of the outcomes of this partnership in terms of what was learned and what was gained from my perspective. So I can really go on and on about what I learned from working with ACT and Deborah, but I only have a short time. So some of the main benefits of this partnership were access to training and expertise from Deborah and from ACT. She's a very active and engaged advocate in this community. She's also extremely connected to decision makers and ministry representatives that are able to mobilize this research into practice. And like I mentioned before, her involvement in the recruitment stage really helped gain exposure and helped increase the number of participants significantly. We ended up getting almost double the amount of participants that we had anticipated. And her involvement helped us really focus on the bigger picture. And like I said before, increase the relevancy of our research and our findings. And now as we enter this knowledge translation phase of our study, she continues to be involved in getting this research into the hands of people who influence policy and can help provide recommendations for the government and the relevant ministries on how best to support families during this extremely challenging time and address their specific needs. So firstly, I just want to thank and acknowledge all of the families that participated in our study, as well as our partner organization and collaborators. I would also like to thank Kids Brain Health Network and MITACS for this amazing opportunity and for the funding and support provided. So thank you.
Hi everyone, my name is BUSE, and I'm one of the MITACS Kids Brain Health Network interns this year. My internship project aims to understand how service delivery models, such as access to services and barriers to services, have changed in light of the pandemic for families who have children with neurodevelopmental disabilities. For my internship, I'm working with the Center for Child Development in Surrey, British Columbia. The Center for Child Development was first established in 1953 and has been serving the community since then. When it was first established, it was just a group of parents organizing transportation for their children to therapy services. However, currently it provides a range of services and supports the children and their families in Surrey, British Columbia. The services that the center provides include psychological services such as therapy, speech-language services, daycare, doctors, social workers, and physiotherapists, and other things as well. So pretty much anything that you can think of. The center serves both children in their early years, so children who are younger than 5 years of age, and school-age children up to 19 years of age in BC. In addition to this, the center serves a variety of cultural groups in BC and provides them with cultural resources and services. The center is also the only Commission on Accreditation of Rehabilitation Facilities, or the CARF accredited program that provides services in Western Canada. So in terms of the focus of my internship, the focus is to work with the center and other service providers in the South Fraser district in BC to understand families and service providers' experience with the COVID-19 pandemic, with the hope of providing some suggestions for policymakers to improve services during and after the pandemic. In terms of my internship experience, it has been a little interesting and different than what we expected due to COVID-19. Because of COVID-19, the center is still closed for in-person services. Thus, we had to switch our research program to a model that's all online, so conducting online meetings, online interviews, etc. Currently, it has been working really well, and we're lucky that we were able to adapt our schedules and our research program to working online. Currently, we're in the stage of recruiting more families, so currently we have about 12 families, and we're conducting interviews with them and with service providers as well to understand their experiences. For the poster session, I don't have any results to share since we're still conducting interviews. However, I'm really interested and excited to share our results in the coming months. Thank you.
Well, that was wonderful. Early career researchers talking about exactly the sort of research with impact that MITACS loves to support. So we've heard from the researchers describing their research projects which are intended to solve problems created by COVID-19. The KBHN MITACS research fellows have done a great job describing their research, but I think now's the time to hear from the partners, because all of these research projects have strong partnerships with community-based organizations. Again, this is the sort of work that MITACS supports. And so I'm going to introduce all of the people on the panel who represent the 7 organizations that we heard about in the research presentations. I'm going to run through introducing them all. They're going to speak in basically the same order as we heard the research projects presented. Again, apologizing for mispronouncing names. And I'm going to well, I'll get to the question once I introduce them all. So first up is going to be Margaret Spolestra. She's the Executive Director of Autism Ontario. Then Jonathan Lai, who is a Director at the Canadian Autism Spectrum Disorder Alliance. Heather Lacey is from Citizen Advocacy Ottawa. Mazon Laka-Evan is from Cerebral Palsy Association of Alberta. Joanna Neffs is from AID, which, as we heard, is Autism Intellectual Disability National Resource and Exchange Network. That's a long title. AID is probably better. Deborah Pugh, who's from Autism Training Community ACT. And Brian Katz is the Vice President of Child and Youth Services at the Center for Child Development. And I also realized, and we were told during the presentation, that in fact, Citizens Advocacy Ottawa with Heather Lacey is now called ABLE2. So the question for all of you is, we've heard about the research projects, and we hope these research projects will have impact. So reflect as partner organizations what these research projects have meant to your mission and how this has helped in the current COVID-19 crisis, how this has helped your organization's mission in this COVID-19 crisis. And so, Margaret, we'll start with you.
Thank you very much, John. I'm delighted to be here today, and we are thrilled to have Vivian Lee joining us as a researcher through this MITACS grant process. And I would say there are probably 4 key things that have impacted us by having her join in our team. And really, I should say that she has in fact joined our team, which is already its own value added, to be able to have that type of expertise brought into a team that really connects with the community. So I would say she's really increased our collective knowledge of the literature on COVID-19 as it applies to autism and mental health. And for us, that matters tremendously because we support families across the province of Ontario through our 25 chapters and through staff who are helping to provide service navigation for the Ontario Autism Program here. The other thing I would say is that she has informed our thinking on a survey that we conducted this summer, which was to ask parents what they needed as their children transitioned back to school, children on the autism spectrum, and what they needed and what those impacts were. So already the research that she had completed with Dr. Jonathan Weiss just helped us to really think through that, the kinds of questions we needed to ask to keep it short and simple so that people didn't feel overwhelmed by a survey and that we had good information to give back to the province about what parents were experiencing and what they needed to make that transition as much a success as possible given the challenges that families were facing. So that added to our credibility as well, and I think allowed us to really create information from that survey that gave parents the ideas, some of the ideas that we could then further elaborate on to assist them. And then she mentioned this herself in her own presentation, but she also assisted us in how we can measure the impact that our service navigators provide in their interaction with caregivers during this very stressful time. And that was all across the province of Ontario, and that work is still ongoing. So we'll be looking forward to the results of that. And then finally, I would say she helped us with the broader grant applications that we're working on with multi-universities and bringing us together in other grant processes and informing that because of her knowledge in mental health and autism. And I would say her presence has also just added staff confidence. And so we are delighted to have her here and to be part of this grant process. Thanks.
Thank you very much, Margaret. And we know all of our interns are of very high quality. We're very pleased with the people we work with. Jonathan, same question to you.
Sure. So thanks for having me on the panel. You know, we just saw an excellent set of projects, and I think the take home for me is that embedded research capacity within community organizations on the front lines, it's crucial, especially at a time like now when there's emergent challenges on the ground with this pandemic. We always thought of the KT framework of bench to bedside, and some people would like to quote the 17 years. That some of that's necessary for the checks and balances. We think about the COVID vaccine, all the rest. But right now, with things fluctuating so much in the environment, rapid response is crucial, and research skills are necessary in that endeavor. So in our case, Jackie's skills and her network, and I'm sure all these other researchers who are part of these community organizations really add a lot of value in thinking about how to rapidly respond with an evidence-based way. So I really think it's a powerful way, and to me, it's a microcosm of what I would call a rapid learning health system. And right now we're thinking about it project by project with these smaller MITACS grants, but if we can scale beyond that and think about how do we transform a system, same way we've done so in the patient and family-oriented research side of things, how do we embed researchers at every stage and at every level in our delivery of services? I think this is a great model to build on and continue, and we see a lot of great work that has come out from these MITACS partnerships.
Thank you so much, Jonathan. And of course, as a researcher, I would agree that research is always a good thing to have in any organization. And actually, MITACS is thrilled to be able to work with community organizations like the ones on this panel. Heather, you are next.
Yes, hi. So thanks very much. I'm really happy to be here. I have to say we were incredibly grateful that we got this opportunity, and especially having MAUDE as our PhD student, a researcher. She had already had a history with Able2, formerly Citizen Advocacy Ottawa. So she already knew a lot of the inner workings of the organization when she came to us. But for an organization our size, where we are only funded 30% of our funding is stable, the rest of it we raise. This has been a really important opportunity. So we had to pivot quite quickly to online services. And the fear always is when you're doing something so quickly without enough time to plan, oftentimes you want to make sure that what you're doing is effective for the families that you're providing the services for. So in that way, this has been a really great opportunity for us. Also, I think for us as well, this will also help us to ensure that we first are advocating in areas that are needed. And in fact, we've identified a number of different areas in which we now will scale up our advocacy. It also has given credibility now to some of our foundation and grant applications, which is really important for us as well. There's so much money available out there now. It's really important to have really strong, credible data to put into those grant and foundation asks. And also, I think as well, not only do the researchers learn something, but I think the organization itself learns something about the research side and how important data is to get us at the policy tables and for us to actually have some impact in those policy areas at both the local and, oh, I'm so sorry, at the local and federal and provincial level. I am so sorry about that. I'm done.
It happens. It happens all the time. Don't worry. And I think you know, Heather, it was great that you brought up the benefit to the student, because I think this is, you know, it's good for students to work on, you know, so-called real world problems, to get out of their university labs and work with partner organizations. So, Mazon, it's you're next.
That's a tough act to follow, Heather. Thank you, John. On behalf of the Cerebral Palsy Association in Alberta, we're thrilled to have had three amazing MITACS students with us: Jessica Kohek, Ash Seth, and Candace Parsons. What an amazing three young people they were. Many times as we started our project, which is the Reentry Strategy for Persons with Disabilities Task Force, looking at ways in how families can adapt to COVID and all of the questions that came with that. And the students came, and this is the first time for us, and they brought with them their wisdom, their energy, and we needed energy in those dark days of COVID in March and April. And what they did is that all the things you all mentioned prior is the research and the capabilities of being able to go a little further than what was being presented, and being very intuitive of something we did not know what we were faced with. Every day the landscape was changing. Every day there was a new glitch in what we were attempting. And what we did attempt to do is to look at 4 areas of priorities that we can wrap our heads around. And that was getting in, staying out, because not everyone wanted to get back into the community. And if you wanted to stay in, there should be supports for that. Transportation, how do we get to where we need to be? Safe, barrier-free design, what was the new world going to look like? And of course, most importantly, affecting all of our organizations is the mental health and the family stresses. The 3 students brought with them integrity. Before I can get the suggestion out of my mouth, they were already writing 2 papers on it. We had midnight conversations, we had texts and Zooms, and I know in the last 6 months, I've seen these students more than I've seen my own family. And we've become, I only met them recently, face to face, and which was very awkward in COVID. But honestly, having this opportunity and the privilege is given our organizations, so much so that there's been more ask for partnership with MITACS to be able to, for us to develop much more of the work. We've just scratched the surface. And when I now can see what is available out there, I'll be probably calling you, John, to see what awaits us. But again, for an organization like ours, this has really taken us to the next level. The only downside I can see with this is that there isn't enough time. There was so much more that we could have done with this project, and we will continue because of the commitment of the students, but we are extremely grateful. And I think this is an amazing relationship for us to have with MITACS. So thank you.
Well, thank you very much, especially for the offer of repeat business. And you'll be happy to know that Government of Alberta has just recently boosted our funding so we can do even more in Alberta. And so that means we can do more with you.
Oh, first on the list then.
Joanna, you're up next.
Thank you so much. So my name is Joanna Ness. I'm the CEO of the Autism and or Intellectual Disability Resource Exchange Network, which you pointed out is just such a easy name, rolls off the tongue. So we've got AID Canada as our short form. So AID Canada's focus is really about getting information to the people who need it. And there's so much information out there in the context of COVID-19, and particularly at the beginning of the pandemic. There is lots of information floating around, and some of it isn't accurate and some of it isn't necessary or useful. And what our two amazing interns, Dr. Wendy Mitchell and ZULLA, did was enable us to really focus our attention on the issues that are articulated as being important to our community members. So being able to talk to and get evidence-based research on what our community members, both family members and self-advocates, feel is the kind of information as far as topics go that was most useful, but then also in a sense of what information is most useful in terms of format has been essential in our ability to centralize the information that is most relevant to our community and to dig down deep into what is going to be most helpful in getting the pinpointed information quickly to the people who need it. So that's really the basis of what AID wants to do, and that's what this MITACS internship enabled us to do. So it really spoke to the core mandate of our initiative, which was fantastic and amazing. And so we were also, like everyone else, like just blown away by the skill and the quality and the dedication of our MITACS interns, and we were just thrilled to be part of this program, and we'll be second on the list for the read.
Well, maybe I'm biased. I've got a grandson on the spectrum, and information is absolutely critical, and the amount of junk information out there is stupefying. And so I'm so glad that our interns are contributing to this important cause. Next up, Deborah.
Hi. Well, I want to start by thanking you for all of this exciting presentation that we're seeing, John. It's great to see what's happening in the rest of the country. I think, especially for small not-for-profits, finding out what's going on in other organizations is really important. So we appreciate it. For us at ACT, the relationship we've had with Simon Fraser University, in particular Grace Irochi, goes back probably 15 years. So we felt in the initial 2 or 3 months at ACT, we were receiving an overwhelming number of frantic emails, calls from families, particularly in British Columbia, because everything was frozen and the Ministry for Children and Family Development decided that the money that they got for autism intervention would not be rolled over. They'd use it or lose it, and they couldn't use it. So families were really frantic. Our relationship with Dr. Irochi meant that she thought of us when she, as a registered psychologist, was also seeing families enduring very high levels of mental stress, much of it provoked by this, but generally in the face of all of the pressures of COVID-19. So when she suggested that VANESSA FONG would be interested in working with ACT on a project looking at exactly what families were getting some data on what families were experiencing, we leapt at the chance because we knew, I'm not very sympathetic, by the way, when I get a call from a researcher who says they want us to write a letter of support before they actually explain to us why there's any value in what they're doing, right? I don't know if any of the rest of you have ever had those, but FYI, it's not very respectful. Okay, so when VANESSA started talking to us about this, I was so impressed, and knowing that Dr. Irochi has done so much work, and her colleague, Dr. Alina Birmingham, has done so much work on family functioning and the pressures on families going back over a decade, we leapt at the chance. And I have to tell you that although we knew the situation was bad, when I looked at the results of the data, I was really shocked. I mean, the idea that almost 10% of the families who have children with autism in this province who responded were considering putting their children into care because they could get so little service. That is really shocking. I mean, very shocking. And I'm hoping that these research results are something that we can go back to government with and ask them to take seriously the pressures on families. Because really, this wasn't so much about something that would help ACT, you know, in a sense of, you know, our day-to-day work. What we wanted to do was put the focus on what families were experiencing. And we knew that through our connection with the community and Dr. Iarochi's perceptiveness in what is important in terms of gathering data and the enthusiasm of Vanessa FONG, that we would be in really good shape. And we're very grateful for all the support we got on it. And I can't say I'm happy about the results, but at least it confirms that all our worst fears are indeed realistic. And we don't think this just applies to autism. We think that the results of this study actually applies more broadly to the special needs community in the province and across Canada, because what we're hearing elsewhere very much echoes what we're seeing here in BC. It's specific to BC, some parts of it, but actually there's also an Israeli partner on this research. So there is a much more widespread relevance that I think you should all have a look at, because it's very important research. And thank you.
Deborah, that's wonderful. And by the way, MITACS has international programs as well for researcher exchange. So you can check that out.
Yeah, but don't send Vanessa anywhere in the midst of COVID, you know?
No. Virtual. And I would like to assure everybody, and you all know this, but the broader audience, that MITACS approaches the external organizations first and finds out what the problems are before we approach the researchers, which I think is a winning formula. And last, Brian, and everybody, I congratulate you all for being so disciplined. You're all keeping on time. So Brian, I know you'll keep up with that. And so your turn, your last time. Yeah, no pressure at all.
Thank you very much. And I'd like to add my thanks to both KBHN and MITACS for both involving us in this project and having us here today. My name is Dr. Brian Katz. I'm a registered psychologist and Vice President of Child and Youth Services at the Center for Child Development in Surrey, BC. We are an outpatient medical rehabilitation facility serving roughly 3,000 children a year with a wide variety of special needs. I want to just talk a little bit about some of the learnings we've had from our partnership with MITACS and with University of Victoria. You know, when COVID hit, obviously everything changed, you know, quite quickly. One thing that doesn't change, I think, for all of the folks here today and all of the agencies you see represented, is that we still have a mission and a mandate, and that still needs to be delivered on. We still have clients who are depending on us. We still, as an organization, have values that we need to adhere to. And obviously COVID threw all of that into flux. You know, in terms of research partnership, you know, I would certainly agree with Deborah that, you know, being approached to write a letter first is not the way we certainly like to partner. So I really can't stress enough the importance of finding the right partner. And for us, Dr. Sarah McCowan at University of Victoria and her team, this is really an extension of an existing partnership that we have with Dr. McCowan and her team at UVic. And, you know, the UVic team has really been a true collaborator with us. And it's been really a joy in terms of knowledge flowing both ways between ourselves and the team at UVic. You know, as I mentioned, COVID really has changed everything, and we had to make changes very quickly to how we've traditionally done stuff. And the not-for-profit sector really tends to be a conservative one, so this was difficult. So this MITACS project really provided an opportunity for us to evaluate some of the changes we've made in service as a result of COVID, and to kind of get both qualitative and quantitative data that will allow us to improve our services to families. And then the final thing I'll say, since the clock is at 0, is, you know, it's also provided us an opportunity in the larger sector in our area to really take a role. We've been talking with not only families, but with other agencies and with representatives from government, and really trying to take a holistic approach to evaluating how COVID has changed services for children with neurodevelopmental disabilities and their families. So it's been, as I said, a great partnership, and we're grateful to both MITACS and KBHN for the opportunity. Thank you.
Well, thank you, Brian. And that was, you weren't given your full 3 minutes, so thank you. I have to say that what I've heard from the early career researchers and from the 7 of you has made my day. I think Brian is absolutely right. You know, the work goes on. There's a pandemic crisis on, and in fact, that makes the work even more important. And we've certainly found at MITACS that there's increasing demand for research-based solutions to problems in the midst of this pandemic, and we're here to help. So that's an offer to all of you. So thank you so much. You all know that I was skeptical at the beginning that we could actually get through this important discussion in the 20-some minutes allotted to us. We've done it. I think you've all made, well, your work is fabulous, and I hope we're able to continue contributing to your important work. So thank you one and all. And I think at this point, I'm supposed to turn it back to our MC, Brian Goldman, and wish you all a happy day.